Hey, and welcome back to Noon Edition. Lisa Horstman of the Allen County Health Department is our guest now. And I guess the first question that people have regarding immunizations is, why do we even need them at this point? Aren't most of these diseases gone and long in the past?
Right. We would hope so, but they are endemic in a lot of countries still, and we still have diseases circulating in the United States. Some examples is pertussis, which is, it can be very serious. There's many cases of that, especially harmful to babies. I actually saw a 3-month-old with pertussis.
Oh, wow.
Yeah, and it was scary to watch because it was trying to cough and it wasn't able to, and it had to be hospitalized. And I realized at that point how serious pertussis really was. And there's diseases like measles. And I don't know if you recall, like end of 2022, beginning of this year, there was an outbreak around Columbus.
Yeah.
85 cases, and 40% of those had to be hospitalized, which is really significant for, that number. And so measles is highly contagious. It can cause high fevers, swelling of the brain. And so with the MMR vaccine, you've got 93% protection with one dose and nearly 100 with the second dose. So most of the cases at Columbus were not vaccinated, and they were children. So
I guess the answer to the question I originally asked you is kind of significant, because why we don't have those things anymore is because of the immunizations. Over 16,000 people died a year, but now because we have these immunizations, they're wiped out.
You're right. One of the best examples, I think, is polio, because before immunizations, it killed 16,000 people per year, and it left others with paralysis. So that's not to mention, the people with the paralysis. And today, that number's 0. And so there was one case, I believe, last year in New York, and they quickly jumped on that and contained that. So, but that just shows you our effectiveness of our vaccines, with 0 cases. And these vaccines, that's the other thing that, people who are hesitant, or the vaccines offer that protection, and they've been around for a while. So many of these vaccines have been around for years. So.
Yeah, I think a lot of them kind of took a hit simply because of COVID. People weren't entrusting themselves fully into something that was developed so quickly and given to the general public. So then all immunizations kind of took a hit because of COVID.
That's exactly right. I've heard from school nurses, I've heard from provider offices that have said because of COVID, parents are more hesitant to get their children vaccinated. And that's where I would say, most of these typical vaccines that they're going to get, they have been around, they're safe, they're effective. And I encourage people to call their provider if they have a question. You can always call us at the health department. We have several immunization resource nurses. I'm available a lot of time to answer questions. And here at the health department, we offer vaccines. It's Monday, Wednesdays, and Thursdays, and we prefer appointments, but people, if we have the time, we'll get you if you walk in. And we are contracted with most of the private health insurances, and we also offer the vaccines for children. So if your child's on Medicaid, they're uninsured, we can offer those vaccines. Typically, a person's going to walk out with no charge on vaccines, and that's most places because it's in the healthcare system to provide for vaccines. So,
Lisa Horstman, thank you so much. Very knowledgeable information, and we enjoyed hearing from you. Don't go away. Medical news is coming up next with Holly.